Welcome to the 2022 Annual Enrollment Presentation for Medicare Retirees. This presentation will go over the important facts you need to know going into annual enrollment, the timeline for annual enrollment, your responsibilities as an OGB health plan member, your 2022 health plan options, how to enroll in a new health plan, wellness and disease management options, life insurance, and contact information for both OGB and our vendors. Some important facts that you need to know. Effective January 1st, 2022, there will be a premium increase of 5% on the Blue Cross and Blue Shield of Louisiana, Pelican, and Magnolia plans. Vantage Health Plan has also informed us that they will be instituting a 10% increase on the Vantage Medical Home HMO plan, also effective January 1st of 2022. There will be a new pharmacy benefits manager for the Blue Cross and Blue Shield health plans, also effective January 1st, 2022. Express Scripts Medicare will be the new pharmacy benefit manager for the Pelican and Magnolia plans. If you would like to remain in your current OGB health plan for 2022, you do not need to do anything during annual enrollment. Your coverage will continue as it is today. Now let's take a look at the timeline for Annual Enrollment 2022. Annual enrollment begins October 1st. Medicare Advantage open enrollment begins on October 15th. OGB annual enrollment ends on November 15th, and Medicare Advantage open enrollment ends on December 7th. We do ask that if you are switching from an OGB supplemental plan to one of the Medicare Advantage plans, to please make that decision by November 15th in order to make sure that the billing is done properly. And again, January 1st is when the 2022 plan year will begin. As an OGB health plan member, there are several things you can do during annual enrollment. You can enroll in a health plan, you can drop or add dependents, you can discontinue the OGB life insurance, or if you are in the Basic Plus supplemental plan, you can drop down to the basic life coverage, or you can discontinue your OGB health coverage. But please remember that if you discontinue your OGB health coverage in retirement, you cannot get it back. Now let's take a look at your 2022 plan year options. What are the advantages of enrolling in a Medicare Advantage health plan? Well, most Medicare Advantage plans have low monthly premiums and some have no monthly premiums. Some plans may provide more benefits than are covered under traditional Medicare, and you can generally enroll regardless of your medical history. It is important to do your homework and compare plans, however. Medicare Advantage benefits and provider networks can vary from one plan to another. So before enrolling, please make sure the benefits and rules of the plan that you select meet your needs and your budget. Additionally, please be very careful of TV advertisements and mail or phone solicitations for Medicare Advantage plans. If you are unsure about any communication that you receive concerning a Medicare Advantage plan, please call OGB Customer Service. They will be able to tell you if the plan is an OGB sponsored plan or not. And remember, if you choose to enroll in an OGB sponsored Medicare Advantage plan, you will retain the option to return to an OGB sponsored plan during the next annual enrollment period. The Office of Group Benefits offers retirees with Medicare 7 fully insured Medicare Advantage options. Those are Blue Advantage, Humana, People's Health. Vantage Health Plan has 3 Medicare Advantage options, and then you can choose to go to the Medicare Exchange through Via Benefits. Now let's learn a little bit more about these health plans with some videos.
At Blue Cross and Blue Shield of Louisiana, we've been protecting Louisianians for 85 years. Now with Blue Advantage, you have a local choice for your Medicare coverage. If you're a retiree and you have Medicare Parts A and B, you're eligible for Blue Advantage. Also, spouses who are Medicare eligible can enroll as well. Contact your plan administrator or refer to your plan documents to understand your contribution for this plan. This is an HMO plan, so you must live and get your health care services within the state of Louisiana. You will be covered for emergency services when you're out of state. Enjoy the ease of medical, hospital, and prescription drug coverage, along with dental, vision, hearing, and fitness in one simple plan. Plus, you'll get extras like an over-the-counter benefit, no-cost online primary care provider visits, meal delivery following an acute care hospital stay, and member rewards for completing select wellness activities. Now you'll have the simplicity of one member ID card. That can mean no more confusing coordination of benefits. Just put your Medicare card away in a safe place and start using your Blue Advantage member ID. This will be the one card you will need to get your healthcare benefits. Here are some highlights of the benefits you'll enjoy with Blue Advantage, such as no-cost preventive visits for your yearly wellness visit, and a $0 copay for select vaccines like flu and pneumonia. You'll have a $0 copay for outpatient surgery and a $5 copay to see your primary care provider. Urgent care visits have a $10 copay. Also, you can see a specialist in our network for a $20 copay, and no referral is required. Your maximum out-of-pocket expenses will not go over $2,000 per year. This is the most you pay for copays, coinsurance, and other costs for Medicare-covered services. This amount does not include your prescription drugs. Plus, there is a $0 medical deductible. The doctor will see you now from home. With Blue Advantage, you'll have the option of telehealth visits from your computer, smartphone, or tablet. You'll keep moving with your no-cost Silver and Fit membership. Visit a local gym near you, or get access to exercise videos on your home computer, or order a home fitness kit. The choice is up to you. Choose the safety and convenience of mail order and 90-day fill options for most drugs that we cover. Plus, there is a $0 pharmacy deductible. Blue Advantage is a perfect fit for some retirees, but not all. Before you make your choice, ask yourself these questions. Which doctors, clinics, and hospitals do you visit? Are you prepared to stay in network? Staying in network is very important. Out-of-network care is covered only in emergencies. What prescription drugs are you taking? Are they covered under this plan? Also, are you getting extra benefits that will help to keep you well? Visit us at www.bcbsla.com/Blue Advantage. At our website, you can select Find a Doctor to see which of your providers are in our network. Blue Advantage has a robust statewide network of over 12,000 healthcare providers in all 64 parishes. Also, you can check our formulary to see which of your prescription drugs are included. Still not certain if your doctors are in the Blue Advantage network or if your medicines will be covered? Call us at 1-800-824-4567 to find out. Does this plan sound right for you? Are you ready to enjoy the added benefits Blue Advantage offers? Refer to your OGB Medicare Advantage Enrollment Guide for Plan Year 2021 to find out more. Also, if you'd like to enroll in Blue Advantage, please contact OGB directly.
Hello, and thank you for taking the time to view our presentation where we will cover the Humana Group Medicare Employer Plan for State of Louisiana retirees. Today we will discuss Medicare, your plan, enrollment, your care, and extra benefits and resources. Medicare. How does Medicare work and how is it different from Medicare Advantage? Medicare is the U.S. government's largest health insurance program, serving more than 59 million people. It's run by the Centers for Medicare and Medicaid Services, also known as CMS. It's part of the U.S. Department of Health and Human Services. Medicare is divided into parts. Parts A and B are original Medicare. Part C is Medicare Advantage. Medicare Part C covers everything Parts A and B cover, including hospital and medical services. You still have Medicare if you elect Medicare Part C coverage. Part D is prescription drug coverage. Your plan. What is my plan and how does it work for me? This plan allows you to pick one primary care provider, PCP, in Humana's network to help you organize and manage your care. This provider knows you and your medical history and will help you get the care you need. However, with an HMO, you must see a healthcare provider who participates in Humana's network for your care. To check if your preferred provider is in Humana's network, you can go online to humana.com and use the physician finder. With every Humana employer plan, you will have no copays for preventive care, you will have an out-of-pocket maximum, and you will have worldwide emergency coverage. So with your red, white, and blue Medicare card, we suggest that you keep that at home in a safe place because from now on, you will only provide your Humana ID card at your provider's offices and at your hospitals. This plan has a $0 annual deductible and a $2,000 annual maximum out-of-pocket. We've also broken care into hospital versus non-hospital so you can see what you will pay for each item. The annual maximum out-of-pocket is the most that you will pay for your coverage services throughout the plan year. If you reach $2,000, the remaining medical expenses are covered by Humana at 100%. With your Humana plan, you have access to network mail delivery pharmacies, including Humana Pharmacy. Mail delivery pharmacies can ship your medications to your door and often remind you when it is time to refill your prescriptions. We've mentioned mail delivery pharmacy and Humana Pharmacy mail delivery, but let's go into more detail on exactly what you get by using Humana Pharmacy. To start off, 2 pharmacists check every order that goes out to ensure they are safe and accurate. The drugs get shipped right to your door or provider's office, whatever is most convenient for you. And if you have questions, there's a team of pharmacists and technicians only a phone call away. Additionally, Humana Pharmacy reminds you when your prescriptions need to be refilled. They can call you, email you, or text you, whichever you prefer. Call us with questions at 1-888-538-3518, Monday through Friday, 8 a.m. to 11 p.m., and Saturday, 8 a.m. to 6:30 p.m. Eastern Time. Humana is proud to offer prescription drug coverage to help serve retirees' needs. Our PDP plan provides many features that may make filling your prescriptions easier. It comes with additional member-facing benefits, including coverage for your specialty medications and access to a mail-order pharmacy. The important thing to know about our PDP plan is that it gives you coverage for all drugs that are approved by CMS. The way coverage works with Part D is that each of the major types of prescriptions are broken out into categories or tiers. The tiers are typically broken up by whether the drugs are generic, preferred, brand, or specialty. You will pay different amounts depending on what type of drug it is, and another factor that determines the cost of your medications is whether you get a 30-day or a 90-day supply, and whether you pick up your prescriptions in person from a pharmacy or use a mail delivery pharmacy like Humana Pharmacy. To the right, there are some example medications that fall into each category. Enrollment. What do I do next? What do I have to do to enroll in this plan? If you would like to join the Humana plan, you just need to complete the form in the booklet OGB sent to you and send it back to OGB. They will notify Humana of your enrollment. You can also take a look at the materials OGB sent to you and compare both benefits and monthly premiums so you can make an informed decision on what plan is best for you. Your care. What to expect after you enroll. After you're enrolled, you will receive an enrollment confirmation letter. This letter confirms that the Center for Medicare and Medicaid Services confirmed your enrollment in the Humana plan. Then you will receive your Humana member ID card. This arrives in the mail approximately 2 weeks after you are enrolled. You will also receive an evidence of coverage booklet. This is a detailed booklet in the mail that includes your healthcare plan coverage and privacy notice. Then you will receive a Medicare health survey. This is an optional survey that CMS requires Humana to ask new members to complete within their first few months of enrollment. Instructions on how to complete the survey are included in the booklet mailed to you. Humana's online provider directory is a convenient way to find a current list of hospitals, doctors, and other healthcare providers in Humana's network. You can locate the Find a Doctor tool by clicking the Find a Doctor tool on the homepage at humana.com or on the My Humana mobile app once you are a member. Humana's group Medicare plans address the full spectrum of your health needs, from overcoming a chronic condition or supporting your journey towards better health and security. One of the biggest advantages of Humana's Medicare Advantage plan is your access to additional programs at no additional cost to you. Silver Sneakers allows you to join any of their nationwide network of gyms. You can check them out on silversneakers.com and find any gyms in your neighborhood. On Go365, you earn dollars that can be redeemed for gift cards in the Go365 mall. You earn dollars by doing preventive activity, physical activity, or any social activity. You can check them out at Go365.com. My Humana is your online portal where you can check the status of your claims year to date, track your healthcare spending, set your preferences for mail and items such as My Directives. My Directives is an end-of-life care planning tool where you can set your preferences for items such as donation, organ donation, autopsy, and you can share these preferences with your family, friends, or your providers, whomever you feel should have access to this information. Next is the Humana Well-Dine Meal Program. After you've had an inpatient stay in a hospital or skilled nursing facility, you're eligible for up to 28 meals shipped to your door after you're released from the hospital. Humana at Home is our care manager program. If you're paired with a care manager, if you have a chronic condition, they can help you understand your doctor's advice, they can help find ways to afford your medicine, and they can help arrange transportation to and from your appointments. After you enroll in our plan, we want to make sure that we are there for you if you have any issues, questions, or concerns. That being said, we have multiple ways to stay connected with Humana in order to have the best possible plan experience. We have a dedicated customer care team that will help you with anything you need related to the Humana plan. They can be reached at 1-877-889-9885, Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. Once you've received your card, you can also register on humana.com and sign up for the mobile app. To learn more about the Humana plan, please visit the OGB website, and you can view a more detailed recording that will go in depth on the details of the Humana plan. Thank you again. Stay safe and be well.
Join People's Health. You'll never be sorry. It has everything you could need or want in a program with Medicare.
Thanks, Peggy. We love hearing this from our plan members because helping our members is our #1 goal. As an OGB retiree, you have dedicated years to making Louisiana a better place. For over 25 years, People's Health has helped countless people in Louisiana enjoy the best health possible. Founded by physicians and medical providers in 1994, People's Health focuses solely on helping people with Medicare. And our success is built on the individualized attention we give our members. Today, we are part of the United Healthcare family of plans. Both organizations share a commitment to helping our members live happier, healthier lives. For OGB, we offer a Medicare Advantage plan that includes Part D drug coverage, as well as additional benefits. Benefits like worldwide urgent and emergency care, dental and vision coverage, and a fitness center membership. It's an all-inclusive package, making it easy and convenient to get the care you need. No need to file claims to get reimbursed. You just present your People's Health ID card. Medicare Advantage plans are also known as Medicare Part C. They combine your Part A hospital insurance and Part B medical coverage, such as doctor's visits and outpatient services, into one plan. And many MA plans, like ours, include Part D prescription drug coverage. When you join a Medicare Advantage plan, you still have Medicare, but your benefits are administered by the Medicare Advantage organization. The Centers for Medicare and Medicaid Services, or CMS, regulates and oversees Medicare Advantage plans. Our rich healthcare benefits make People's Health one of the most popular Medicare Advantage plans in Louisiana. And it shows in our Medicare Star rating. People's Health has a track record of quality, having earned Medicare's highest rating in the state. With People's Health, you can enjoy great benefits like $0 copays for primary care doctor visits, $5 copays for urgent care, $10 copays for specialist visits, and you don't pay anything for virtual doctor visits and for many of the preventive care, screenings, and services you use most. Remember, if you travel, you're covered for emergency and urgent care worldwide. You also get those additional benefits not covered by Medicare, like vision, dental, and a complimentary fitness center membership. There's no cost for home-delivered meals after an inpatient hospital stay, and respite care services for members with dementia, including Alzheimer's. And with People's Health, Part D drug coverage is included, with coverage for all drug tiers through the Medicare Part D coverage gap. Plus, although we'd like you to go to doctors in our network so we can help coordinate care, People's Health Group Medicare for OGB also has a point of service option. That lets you see providers who are out of our network for certain services. We are confident that when you review and compare all the People's Health benefits to the other Medicare options out there, you'll see the advantages of People's Health. And we hope to see you soon as a People's Health Plan member. Thank you for your time and interest in People's Health, your Medicare health team.
Vantage Health Plan is excited to once again be offered as a health plan to Office of Group Benefits employees and retirees who are eligible for Medicare Parts A and B. Vantage will continue to offer 3 Medicare Advantage plan options. We will review these plan options later in this video. If you're already a Vantage Medicare Advantage OGB member and you would like to stay in your current plan, you don't have to do anything. You will stay enrolled in your same plan unless you make a plan change through your agency or OGB. These plans are sponsored by OGB and you don't lose any of your state retirement benefits when you choose a Vantage plan. Open enrollment for OGB members who are enrolling in a Medicare Advantage plan is October 15th through December 7th, and we would be pleased to have the opportunity to serve you. If you have questions after watching this video, please reach out to Vantage by calling 844-536-7103. The Vantage Medicare Advantage plans are available statewide in every parish to all eligible OGB employees and retirees. Our provider network spans the entire state of Louisiana and many of the adjoining counties in Arkansas and Mississippi. Vantage has hospital contracts with Our Lady of the Lake Regional Hospital, Woman's Hospital in Baton Rouge, Lake Charles Memorial, Tulane Medical Center in New Orleans, and Rapides Regional Medical Center, to name a few of the Louisiana facilities. Our participating hospitals ensure great care and great coverage across the state. We also have several of the state's largest physician groups in Network 2, including Crescent City Physicians, Our Lady of the Lake Physicians, Affinity Health Group, Baton Rouge Clinic, Christus Health, LSU Health Systems, Lourdes Physician Group, and others. Vantage is affiliated with Affinity Health Network, which is a network of preferred providers across the state. These providers include primary care providers, specialists, outpatient services, and surgeries and after-hour clinics. You can receive reduced cost share from Affinity providers. In our plan documents, look for lower cost share listed as AHN. To find in-network providers, visit www.bhp-stategroup.com, click the OGB Medicare Advantage link, and then the Find a Doctor link. Follow the steps shown here to find our participating providers. Vantage currently offers 3 Medicare Advantage plans to OGB members: the Basic Plan, the Standard Plan, and the Premium Plan. Vantage makes your healthcare simple, both when you're healthy and if you get sick. Vantage members have a $0 primary care office visit copay and low specialist office visit copays that includes most services performed at the office, including most lab work, tests, and screenings. Each of these plans include your major medical benefits, plus prescription drug, vision, and dental benefits. Our plans also include other extra benefits like select over-the-counter products, mail-order prescriptions, transportation assistance, hearing services, a fitness program with a gym membership through Silver and Fit, and more. Our members can also take advantage of worldwide emergency coverage, meaning you're covered for emergencies when you travel. These 3 plan offerings vary by monthly premium, copay amounts, and prescription drug coverage, so you can choose the plan that best fits your budget and your lifestyle. Be sure to review the plan documents posted on our website. Go to www.bhp-stategroup.com and click the OGB Medicare Advantage blue button. The Documents and Forms section includes the Plan Finder and plan-specific detailed information. In addition to covering your medical needs, Vantage also covers extra benefits like vision and dental services. There is no additional premium because this vision and dental coverage is included as a part of all Vantage Medicare Advantage plans. Routine vision exams are covered annually for a $0 copay when you see a participating provider. Our plans also include up to $300 per year for your glasses or contacts. To keep your mouth healthy, Vantage also covers dental services included as a part of our Medicare Advantage plans. Routine preventative dental exams and cleanings are covered at 100% twice each year. Vantage will also pay toward fillings, crowns, and other basic and major dental services. Vantage's pharmacy benefit covers a broad range of prescription drugs. We use a 5-tier formulary, which is a list of covered prescription drugs. On our OGB Medicare Advantage webpage, click the Documents and Forms link and then use the formulary to see if your drug is listed and its tier. If you take maintenance medications, consider our $0 mail order benefit through St. John Pharmacy. You can receive a 100-day supply of Tier 1 preferred generic drugs delivered straight to your door at no cost to you. St. John Pharmacy staff can help you transfer prescriptions and coordinate medication deliveries. Vantage has recently added a preferred retail prescription drug benefit too. This means you get your 100-day supply of preferred generic drugs at a local pharmacy at no cost to you if the pharmacy is one of our preferred retail pharmacies. Check your pharmacy directory for a listing of preferred pharmacies. Vantage members can also access their medical and pharmacy claims, authorization, and account information 24/7 through our secure member portal. All plan documents are posted there for you as well. We appreciate your time. Thank you for watching this video. If you have additional questions about any of Vantage's Medicare Advantage plans, we would love to help. Our member services team is available 7 days a week from 8 a.m. to 8 p.m. from October 1st through March 31st. After March 31st, our member services team is available 5 days a week, Monday through Friday from 8 a.m. to 8 p.m. You can also email any general questions to memberservices@vhpla.com. We look forward to serving you.
Additionally, you may choose to go to the Medicare Marketplace through VIA Benefits. VIA Benefits allows you to customize your insurance. They also offer plan advice and enrollment assistance through their benefits advisors. You can contact a benefit advisor at 855-663-4228, Monday through Friday from 8 a.m. until 8 p.m. A plan through Via Benefits also includes a health reimbursement arrangement. A single retiree can receive HRA credits of $200 per month, and a retiree plus spouse will receive HRA credits of $300 per month. These HRA dollars can be used to help with qualified medical expenses. Via Benefits offers a variety of tools to help you compare plans and premiums. For a complete list of plans and providers, please visit my.viabenefits.com/OGB or call Via Benefits at 855-663-4228. Now, Medicare Advantage plans are an option. They are not a requirement. Medicare retirees can also select from the 5 OGB plans during annual enrollment. Those are the Pelican HRA 1000, the Magnolia Local Plus, Magnolia Open Access, Magnolia Local, or the Vantage Medical Home HMO plan. Now let's learn a little bit more about those plans through these following videos.
The Pelican plans are consumer-driven health plans. They have lower premiums but higher out-of-pocket costs throughout the year. They are good for members who want more control over their healthcare spending. Pelican HRA 1000 uses Blue Cross's large statewide preferred care provider directory. Members also have access to Blue Cross and Blue Shield Association national providers. Out-of-network coverage is also provided. Active employees, retirees without Medicare, and retirees with Medicare are all eligible for this plan. Pelican HRA 1000 offers a low premium combined with a health reimbursement arrangement, or HRA. OGB puts a set amount of money each year into your HRA. You use your HRA to pay for covered medical expenses until the fund is used up. As long as claims are submitted properly to OGB, OGB will pay claims directly from your HRA to providers. You will not have to do anything. Your HRA can be a good way to save money for future health care, since unused HRA funds roll over to the next year, as long as you remain enrolled in the Pelican HRA 1000 plan. If you leave your employer or switch plans, money in the fund returns to OGB. Pelican HRA 1000 is a co-insurance plan with a deductible. You pay 20% of your healthcare costs for an in-network coverage, while OGB pays for the other 80%. You will pay 40% of costs for non-network providers, while the plan pays 60%, so it costs less to stay in your network. Pelican HRA 1000 has an out-of-pocket maximum. After you reach that number, 100% of your qualified care will be paid by the plan. Pelican HRA 1000 does not have separate deductibles and out-of-pocket maximums for members who retire before March 1, 2015. Magnolia plans offer higher premiums in exchange for lower out-of-pocket costs throughout the year. Magnolia plans could be good for members who want the peace of mind of level costs throughout the year. Magnolia Local Plus uses Blue Cross's large statewide preferred care provider directory. You will also have access to Blue Cross and Blue Shield Association national providers. In the Magnolia Local Plus plan, out-of-network coverage is provided in emergencies only. You will have to pay 100% of other non-network services. Active employees and retirees with and without Medicare can sign up for Magnolia Local Plus. This plan uses co-payments and co-insurance. Many services are offered for a set co-payment, but some use co-insurance for which a low deductible applies. Magnolia Local Plus also has a low out-of-pocket maximum. After you pay this amount in co-payments and co-insurance, you will be covered at 100%. Please note that members who retired before March 1st, 2015 have different deductibles and out-of-pocket maximums. Magnolia plans offer higher premiums in exchange for lower out-of-pocket costs throughout the year. Magnolia plans could be good for members who want the peace of mind of level costs throughout the year. Magnolia Local Plus uses Blue Cross's large statewide preferred care provider directory. You will also have access to Blue Cross and Blue Shield Association national providers. In the Magnolia Local Plus plan, out-of-network coverage is provided in emergencies only. You will have to pay 100% of other non-network services. Active employees and retirees with and without Medicare can sign up for Magnolia Local Plus. This plan uses co-payments and co-insurance. Many services are offered for a set co-payment, but some use co-insurance for which a low deductible applies. Magnolia Local Plus also has a low out-of-pocket maximum. After you pay this amount in co-payments and co-insurance, you will be covered at 100%. Please note that members who retired before March 1st, 2015 have different deductibles and out-of-pocket maximums. The final Magnolia plan is our Select Network plan. This means that the networks are designed for people who live in specific parishes. Magnolia Local is a health plan for members who want local access, affordable premiums, and a new approach to health care. A select network doesn't mean less care. We've worked with major providers to create networks in your hometown that can care for all of your health needs. You will still have a full network of primary care doctors, specialists, and other healthcare providers in your area. Members who live in the greater Baton Rouge area use the Community Blue Network. Providers in this network include Baton Rouge General Medical Center, Baton Rouge Physicians Group, and the Baton Rouge Clinic. Members who live in the Lafayette, Greater New Orleans, Shreveport-Bossier, or St. Tammany regions use the Blue Connect network. Blue Connect includes some of the biggest providers in those regions. Magnolia Local is a perfect fit for some, but not others. Before you choose Magnolia Local, consider these questions. Which doctors' clinics do you go to the most? Which clinics, hospitals are closest to where you live? Are you prepared to stay in network? Staying in network is very important. As long as you receive care within your network, you will pay less than if you receive care outside of the network. Out-of-network care is covered only in emergencies. Active employees and retirees with and without Medicare can sign up for Magnolia Local. Magnolia Local uses co-payments and co-insurance. Many services are offered for a set co-payment, but some use co-insurance for which a low deductible applies. Magnolia Local also has a low out-of-pocket maximum. After you pay this amount in co-payments and co-insurance, your care will be covered at 100%. Please note that members who retired before March 1st, 2015 have different deductibles and out-of-pocket maximums.
As a retired Louisiana state employee, did you know Vantage Health Plan is an option for you? This plan is sponsored by OGB, so your retirement benefits stay the same, even with private health insurance.
I feel very fortunate to be a member of the Vantage Health Plan. About 10 years ago when I retired, I attended a teacher retirement presentation and we were given options. I had always stayed with Office of Group Benefits. I was very impressed by other retirees who had chosen the Vantage Health Plan, and their testimonies and their personal experiences convinced me that Dickie and I would be really pleased.
Our members can take advantage of worldwide emergency coverage, meaning you're covered when you travel. Vantage's Medicare Advantage plans for OGB members include your major medical benefits, plus prescription drug, vision, and dental benefits. Our plans also include extra benefits like over-the-counter products, mail-order prescriptions, transportation assistance, a fitness program with a gym membership, and more. There are several plan options with premiums to fit your monthly budget.
The co-pays on my office visits with the doctors, quite reasonable, and I pay virtually nothing for my prescription drugs. Another thing that I really enjoy about Vantage is that I love to travel, and I know that I am covered virtually anywhere I go with emergency medical service, and I'm taken care of anywhere.
If these benefits sound good to you, call us or visit info.groupbenefits.org, click on Health Plans, and search for Vantage.
You can learn more about your health plan options on the OGB Annual Enrollment website. That address is annualenrollment.groupbenefits.org. And OGB encourages you to make sure that you choose a doctor or hospital in your provider network when you need health care. By choosing network providers, you avoid the possibility of having your provider bill you for amounts in addition to applicable copayments, coinsurance, deductibles, and non-covered services. This is often referred to as balanced billing. Now that you've learned more about your health plans, let's learn a little bit more how you can enroll in a health plan. Retired employees may enroll or make changes through one of the following options. You can enroll in a new health plan with the same cover dependents as 2021 through the OGB Annual Enrollment Portal, through the Annual Enrollment Form found in your enrollment guide, or through OGB. You can enroll in a new health plan with different or new cover dependents than 2021 by going through OGB. And you can drop coverage, but you have to go through OGB to do that. And remember, if you discontinue your OGB coverage in retirement, you cannot get it back. To enroll through the OGB Annual Enrollment Portal, you will use the following steps. Follow the links from the OGB homepage, info.groupbenefits.org, to the Annual Enrollment Portal. On the right-hand side of the screen, you will see Step 3, Choose Your Plan. You will select non-LGOV employees and all retirees. Additionally, if you lost your annual enrollment guide or did not receive it, you can also download a paper enrollment form from this location. You will log into the enrollment portal by entering your last name, your date of birth, the last 4 digits of your Social Security number, and your zip code, and press Submit. Next, you will need to confirm your contact information. Please view your email address and mailing address and make the necessary changes. Once everything is to your liking, press Confirm Address. Next, you will make your health plan selection for 2022. After making your selection, you will review them and click Confirm to save and view your confirmation page, or if you see a mistake, click Change to revise your selections. This is what the confirmation page looks like. You should print, email it, or save this confirmation page for your records. Now let's talk about wellness and disease management. The Office of Group Benefit cares about its health and well-being of our members, and that is why we offer several wellness and disease management programs to our members. For our Medicare retirees, those are the Access Today Health, Live Better Louisiana, and Blue 365. Let's learn a little bit more about how Access Today Health works by watching this short video.
Access to quick and affordable healthcare should be easy to find. And now, Better Health is just around the corner. The state of Louisiana and the Office of Group Benefits have partnered with Access Today Health to provide all state employees, their families, and state retirees covered under the Pelican HRA 1000, Magnolia Local Plus, and Magnolia Open Access Health plans with a special VIP clinic membership health benefit at no cost to you. This state-funded benefit gives you access to full primary, preventative, and wellness care with no copay, no deductibles, no out-of-pocket costs, no appointment needed, no insurance hassles, and a short wait time. Access to quality care is quick and simple. Finding your nearest Access Today Health clinic is easy. Just download our Clinic Finder app, visit accesstodayhealth.com, or simply call 800-797-9503 for clinic locations. When you need medical care, visit an Access Today Health clinic near you and receive treatment with no appointment necessary. Simply identify yourself as an Access Today Health member when you arrive. Now that you know how it works, let's look at an example. Meet Jane. Jane is a public school teacher on a budget with limited time. She wakes up not feeling well on a school day. Like any busy teacher, Jane can't leave school for several hours to go to the doctor. Thankfully, a nearby Access Today Health clinic is open, and she doesn't need an appointment. As an Access Today Health member, Jane is given the first available treatment room, receives her care, and is back in school in time for her student's big test. With over 50,000 visits this year, Access Today Health is a favorite benefit of our state employees and retirees.
I love knowing we have this awesome benefit. I can also take my children and know they will be treated well, and I don't have to pay any out-of-pocket expense.
The care from the clinic was wonderful for my allergies. I didn't even need an appointment, and there was no copay. Plus, I was in and out in about 45 minutes.
I was hesitant and a little scared to go to the clinic during the COVID-19 outbreak, but after feeling unwell and concerned, I called my nearby clinic and they assured me they were following all the CDC safety guidelines. The medical staff was wonderful and I feel so much better.
Your special Access Today Health membership allows you to get the care you need when you need it. And remember, you are automatically enrolled in the Access Today program as a state employee or retiree if you're on one of these 4 plans. Call us at 800-797-9503. Visit our website at accesstodayhealth.com or download the Access Today app in your app store to find the clinic closest to you.
Live Better Louisiana. Most of you should be familiar with the Live Better Louisiana program. This allows retirees to earn $120 per year credit on their Blue Cross and Blue Shield health plan premium. The clinic information for the 2023 plan year discounts will be forthcoming. Primary plan members enrolled in one of the self-insured Blue Cross and Blue Shield plans, including retirees, are eligible to participate. However, dependents and members enrolled in a Medicare Advantage plan are not eligible to participate in the Live Better Louisiana program. Members must complete the process every year to receive the discount for the following plan year. You can schedule your wellness checkup through Catapult Health or have your doctor complete the primary care provider form. This PCP form can also be completed at an Access Today clinic for those who are eligible. Now let's learn a little bit more about how a Catapult Health clinic works.
Meet Jack. Like most of his friends and coworkers, Jack hates going to the doctor. The time spent waiting, the stacks of paperwork, the hassle. So most years, Jack just doesn't go. But he's in luck this year because his employer has Catapult Health. You see, here at Catapult Health, we bring the doctor's office to you. All Jack does on the day of his appointment is arrive to work a little early. Nurse Lisa from Catapult is ready when he arrives and right on time. Instead of pulling vial after vial of blood to test, Lisa performs a simple stick of Jack's finger. You see, Jack, that didn't hurt at all. Next, Nurse Lisa measures Jack's blood pressure and his belly. Then she hands over a clipboard full of paperwork for him to complete. Just kidding, Jack. That's old school. Jack completes his medical history on a touchscreen tablet, and when he finishes, his blood test results are ready, and it's time to meet with the nurse practitioner. Jack spends the next 10 minutes talking over live video with Amanda about his family health history, his blood test results, and the medications he's taking. They discuss his exercise habits, his favorite ice cream, and that he's been feeling a little depressed since his daughter left for college. Amanda then tells Jack that he's pre-diabetic. Whoa, that got Jack's attention. Amanda provides Jack with an action plan and sends it straight to his smartphone. "I can do this," says Jack. "Yes, you can," says Amanda. And just like that, in 30 to 40 minutes, Jack is done and back to work.
Next, we have Blue 365. Join Blue 365 for health and wellness discounts. You can register at www.blue365deals.com/BCBSLA for discounts from top name national vendors. Discounts include $25 per month memberships to 9,000 gyms nationwide, 20% off all Reebok fitness gear plus free shipping, 10 to 40% off Davis Vision products, and discounts of 20 to 50% off to a network of dentists. Discounts also include discounts on Sprint cellular service, Beltone hearing aids, LASIK, and Nutrisystem. Signing up is free, so again, visit www.blue365deals.com/BCBSLA. Moving on to life insurance, OGB continues to offer the 2 term life insurance plans through Prudential. Retirees who did not select the life insurance plan prior to retirement are not eligible to enroll in the life insurance plan. Retirees who are enrolled in the Basic Plus Supplemental Plan can choose to drop down to the Basic Life Plan. However, retirees enrolled in the Basic Life Plan cannot increase their coverage to the Basic Plus Supplemental Plan. Some plan changes that you need to be aware of for your life insurance. Plan members enrolled in life insurance coverage will automatically have a 25% reduction in coverage on January 1st following their 65th birthday. Another automatic 25% reduction in coverage will take effect on January 1st following your 70th birthday, and your premium rates will be adjusted accordingly. If you have questions or need assistance from one of our vendors about one of the health plans, you can reach out to them at the phone numbers or web addresses located on your screen. This information is also available in the inside front cover of the enrollment guide that was mailed to you. We encourage you to visit one of our websites for more information on your health plans. Our main website is info.groupbenefits.org. Our annual enrollment website is annualenrollment.groupbenefits.org. Our customer service department can be reached at 1-800-272-8451 from 8 a.m. to 4:30 p.m. Monday through Friday. Or you can email them at ogb.customerservice@la.gov. We are located in the Claiborne Building, which is in downtown Baton Rouge behind the state capitol. That address is 1201 North 3rd Street, Suite G159, Baton Rouge, Louisiana 70802. Please note that due to COVID-19, walk-in appointments at our office in the Claiborne Building are by appointment only. So please call customer service if you would like to come in and meet with a customer service representative. Thank you for watching this presentation. We hope that you learned something. And again, if you have any questions about your benefits, please do not hesitate to contact the Customer Service Department.